Welcome to Health Professional Radio. I'm your host, Neil Howard. Real glad that you could join us again. Going to be speaking with returning guest, Dr. William Sandborn. He's joining us from the University of California, San Diego, and he's going to talk about some positive study results in Crohn's disease from the IM-UNITI trial on Stellara's efficacy at 5 years and the Tremfyah Galaxy-1 trial. Welcome back to Health Professional Radio, Dr. William Sandborn.
Thank you. It's a pleasure to return.
For our listeners who may not be familiar with you when you were here before, give us a little bit of your background and talk about your role there at University of California, San Diego.
Yeah, I'm a gastroenterologist. My clinical practice and research is focused on inflammatory bowel disease, so ulcerative colitis and Crohn's disease. I've been in the field for, I hate to say it, almost 30 years. And currently I am chief of the Division of Gastroenterology at UC San Diego and director of the Inflammatory Bowel Disease Center at UC San Diego.
Crohn's disease, of course, it is inflammatory bowel disease. Is that correct? It's just a different, a certain type?
Right. It's an inflammatory bowel disease affecting the small intestine or colon or both.
Is this something that is caused by lifestyle? Is it hereditary, or is it a combination of the two?
Probably both of those things. I think we know that there is an increased risk if you have a first-degree relative that has Crohn's disease. It doubles your risk. Patients who are Ashkenazi Jewish by background have increased risk as well, and those things are additive. We know that smoking markedly increases your risk of getting Crohn's disease. Mm-hmm. And we're suspicious that a number of other environmental factors play a role as well.
There have been some trials with Stellara, I do believe, and Tremfiah. Could you talk about the IM-UNITI trial on Stellara's efficacy at 5 years?
Well, the UNITI trials were the studies that were conducted some years ago to assess the efficacy of Stellara, or ustekinumab, for Crohn's disease, and we looked at its effect for inducing remission and maintaining remission, saw a good benefit with both, and based on that, the drug was approved. But the patients that participated in the original clinical trials went on to a 5-year additional course of therapy, the IM-UNITI long-term extension trial, to better assess the efficacy and safety of Stellara for many years, because, of course, for patients and for physicians, the long-term safety is always a question they have for biologics. And what we found in the study was that Stellara was able to maintain remission overall in about 34% of patients out through 5 years of treatment. And then if you looked at the patients who had previously not been treated with other biologic drugs like anti-TNF drugs, the number was even higher, 44%, although you could see, benefit in both groups. So, those are very strong benefits. The other thing we saw was a marked ability to stop steroids, so-called steroid sparing, and we saw that up to 85% of patients could discontinue steroids.
When you say remission, are we talking a total lack of symptoms or a marked reduction in symptoms and flare-ups?
No, actually a total lack of symptoms. If you look at a marked reduction in symptoms, the numbers are even higher. We saw that up to 57% of patients could have a marked reduction in symptoms over 5 years. And then, 35% of those had a complete absence of symptoms.
Were the symptoms severe going into the trials, or were some of the symptoms mild, or did you have candidates that had a variety of symptoms and disease progression?
No, the trial was done in patients who began with moderate to severe Crohn's disease. We measure that by the Crohn's Disease Activity Index, or CDI score, which can go up to 450 or more, and we recruited patients with scores of 220 to 450, and remission is less than 150. So it was definitely, and the average patient had a score of about 300. So, really quite high scores coming into the study.
Now, Stellara, is it considered or will be considered kind of the go-to therapy based on some of these results?
Absolutely. The other thing that I should mention briefly is that the safety of Stellara was really excellent. We saw a low rate of infection and malignancy that is, similar to what you would see in the background population, and there are no black box warnings for infection or malignancy around this medicine. So when you think about, what constitutes a go-to drug, it's a good efficacy profile and a good safety profile, and we really saw that out through 5 years in both of those domains.
Now, I also understand that there's another product, Tremfiah.
Yes, so Tremfiah, or gasecumab, it's actually sort of a derivative of Stellara, which potentially is even a bit better. So Stellara blocks two inflammatory proteins or cytokines, interleukin-12 and interleukin-23. By contrast, gasecumab, or Tremfiah, blocks only interleukin-23. And you would think, logically, that if you block two inflammatory proteins instead of one, that it would be more effective. But that's kind of not proven to be the case. So Tremfiah is currently approved for psoriasis. And in the psoriasis setting, the pure anti-interleukin-23 class of drugs is superior to the drugs that block both interleukin-12 and 23. So, we've been very interested whether that would be the case in Crohn's disease as well. So the Galaxy study was a study looking at 12 weeks of so-called induction therapy in patients with moderate to severe Crohn's disease. It's a mixture of patients who have previously failed other biologics like anti-TNF drugs or vedolizumab and Tevio, and patients who had failed conventional therapies but not biologics. And in addition to studying 3 different doses of Tremfiah and placebo, there was a reference arm of Stellara. So you were able to see sort of side by side the benefits of Tremfiah and Stellara relative to placebo and to some degree relative to each other. And what we saw in the trial was that both Tremfiah at the 3 different doses and Stellara were vastly better than placebo. But depending on the outcome measure, the endpoint, the Tremfiah results trended towards being stronger even than the Stellara. Now, the study isn't really powered to compare against Stellara, so the primary comparison is versus placebo. But what we saw at week 12 then was that up to 56% of patients had a remission in the overall population compared to placebo, where it was 15.7%. And in the patients who had not failed biologic therapy, up to 65% of patients went into remission compared to 18% of patients on placebo. So very large clinical effect. And then if you looked at the colonoscopy improvement or endoscopic improvement, and realized 12 weeks is kind of a short time for the bowel to heal up. But we saw up to 40% of patients having an endoscopic response with Tremfiah compared to just 11.8% of patients on placebo. And then again, the safety was really very good. We didn't see any signs for infections or malignancy in the Tremfiah-treated patients compared to placebo.
Sounds like some really exciting news for the Crohn's disease community. Where can we learn more about these studies and about Stellara and Tremfiah?
Well, I think the these data were presented at United European Gastroenterology Week, or UEGW, and they are available through the website for that meeting, which was held in October of 2020.
Would there be a link to that at Janssen's website at www.janssen.com?
Yes, I believe there would be.
Well, I appreciate you coming back, Bill. Always a pleasure. I'm looking forward to our next conversation.
Thanks so much for the invitation.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with returning guest Dr. William Sandborn. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download a SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.